We have this young lady who has traveled to us all the way from Manipur. नींद आ रही है? लो आपने सुलाई दिया. So we gave her some anxiolytic so that she's not anxious during the procedure, and this is a cool tipped microwave. So this is how I do the cooling. This is for the fluid tip method also, and these both are for this work. She's not anxious, she's sleeping now. We've given her a little fentanyl and her saturation looks okay. So let me see, I'll give her a little bit of. Now this is a patient who's undergone hemithyroidectomy. So you see the problem of hemithyroidectomy. She's undergone hemithyroidectomy, but if you come here, what I'll do is I'll show you a big scar on her neck. So this is a big scar, you see, this is a scar here. ये तो पूरा scar है, इतना सा काट रखा है. So it's all, she's got a big hemithyroidectomy in Manipur. Half of her thyroid has been removed, and we're going to ablate the lesions in the other half of thyroid. There are certain lesions. So I know it's very difficult to understand why and the right thyroid has been removed, and this is the left one. Left one has these nodules, you see. These are the nodules. The bright one, and this is the other one. So what we're going to do is ablate, and then there is something there also. So what I'm going to do is give her little anesthesia. लगेगा छोटी सुई. So she's not talking to me, she's a little scared, or maybe she has had anesthesia. I mean, anesthesia in the sense she had some there. I'm till the capsule now. Also, no, she also had some hoarseness of voice before during her previous surgery. है ना? Now we're going to ablate. She's okay. कोई तकलीफ हो मुझे बतानी है, ठीक है? ये मैं थोड़ा सा लोकल एनेस्थीसिया दे रहा हूँ आपको. इसके बाद आपको पता नहीं लगेगा ज़्यादा, ठीक है? Okay. So now what I'll need is सब कुछ नॉर्मल बच्चे. फ्लूइड रख. ये नहीं. ये. So what I'm going to do is put some fluid. I'll make a fluid collar around her. The needle I was looking for. So what I'm going to do is I'll go through the thyroid. Put some fluid right let's see where I am now. I'm right outside the thyroid, and so I'll instill some fluid initially in front of the Right, so it's coming down now. Right. So I'm seeing that when I put fluid, so it's a good fluid collar, plus it will act as anesthesis. So let's say if I remove it and try to put it in front, more here. So there. So I'm behind the thyroid. I made a good fluid collar around it. ठीक है, ये फ्लूइड का कॉलर बन गया कैरोटिड और इसके बीच में. ठीक है मन. So let's see what more we can do. So patients are scared, which is okay because it's more fluid and put some so fluid will have local anesthesia in it all around thyroid, so she will not have pain also then, although so that's I'm making some collar in front of thyroid also. चलो so she has all the lesions I'm seeing now. So in this case we'll use more of moving shot for the simple reason that she has multiple lesions and small lesions. I can see at least 3, and now what I'll do is to go behind the thyroid. Now I'm coming behind that. So you normally have a recurrent laryngeal nerve. So here are चलो ऑफ कर 30 वॉट का रीसेट 30 कर कोई पेन तो नहीं हो रहा? गर्मी?
It's bearable.
Bearable. Do you have any heat? I mean, you're feeling hot? AC तेज कर दो बच्चों. चलो बच्चे off.
It's not hot, but it's like a sparking.
Sparking?
Yeah.
Inside?
Yeah.
It's a laser thing. So I just hope you are not bugged too much by that. You can hear crackles, right?
Yeah.
Tuck, 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 like that.
Yeah.
So that's laser, okay? That's right. It's not doing any harm. एक बार और बच्चे. So it's just 1 minute laser over, okay? Reset, continuous. Yeah. If you have pain, we can give you some painkillers. Strong one, opioid, to make you sleep. Do you need it?
It's on fine for now.
It's okay. If you have it, just tell me, okay? चलो ऑफ. ओए होली ऑफ का मतलब ये नहीं कि अपन जंप करिए. Cord, the attachment cord needs to be removed, and the focus really is on. Yeah, that's the lesion. Yeah, and just getting. बच्चे क्या चाहिए? क्या कर रहा है? क्या चेक कर रहा है? हाँ? फोन बंद करके घुसा करो अंदर. चलो स्टार्ट. Pain? It's near the surface. It can cause pain. This particular lesion was close to the surface, so surface is painful. Okay. If you get pain, just tell me. I'll reduce the wattage. चलाओ. चल. Fill off.
This is painful.
This was close to surface. I've stopped it. Now the pain will go. Again, it's close to surface. Chalao, just 30 seconds. I can decrease the wattage, but if you have pain, you don't have pain, then it's okay. Have pain? Should I stop?
It's okay.
Just 30 seconds. 20 seconds are over. Capsule. कूलिंग चल रही है ना? चल स्टॉप. So let me search if there is anything else. So you don't need any thyroid supplement?
Of course, I will if you prescribe me.
No. What I mean is your thyroid profile normal?
I don't know.
Are you taking any thyroid medication?
No, right now I don't
No,
have
no.
medication.
Right, wonderful. चला बच्चे. Now you won't have much pain, right? Because this is not close to surface. Look. ओके टाइमर बढ़ा दे. टाइमर 3 कर दे. 3 10 कर. Do you have any trouble? No?
I think this is how it has to be.
No. How we can give? I just given you 20 mics and go up to 100 mics for pain. But if it is too much painful, little bit okay, because it's awake surgery. So we just want to be ensure that you wake up and quickly are away from hospital. Almost doing small things now. You want it to be finished quickly? चलो बच्चे. Off. Just a little bit. A little bit this side. Good. So there is some retrosternal component which is going right in the chest. We would remove that part. No lesion there, but causing some fell off. Okay, we completed. You're comfortable?
Yeah.
How much marks did I get out of 100?
Excellent.
Did I get?
You're a son of sun.
Huh?
You're getting a son of sun.
Okay, that's the best score. Alright, she's okay. She's not in pain, and her had mostly. Somehow this was growing. You can, I don't know how you can feel or no, into the chest from here. So I'll remove that part also. That was completed. Ask her. She's okay.
I'm okay.
She's okay. So
I can wake up.
you can't wake up without me doing certain changes. Okay. Now you can get up and I'll put the pillow here. Yeah, you don't have to walk immediately. You can just relax for 10 minutes, okay? Finally, there's a needle mark here, which will need small band-aid or some band-aid, okay? That's all done. So your voice is okay?
Yeah, I'm fine.
You are not in too much pain? And your treatment is done.
So if it is like a very big one, then you should go.
Ask me.
I mean, like,
No, the nodule, there, see, one is thyroid, which is of course not like normal because of your lymphocytic thyroiditis. There is inflammation in it, so it has become a little coarse. But in that there were nodules. So nodules we have done, and the part of thyroid which was going down, that I did last. So because it should not go down,
So,
no? It should go inside.
so for a person who have a very big one, you can just finish it in one
No,
session or
no, one session. One session. See, sometimes they might require some years later another session, but by and large one session is it can be done, even large thyroids. Okay.
So you will prescribe you some pills?
Yes,
or?
yes, of course. Lot of pills. How many pills do you want? So I have to see how your thyroid function stays now. Accordingly, if I need to give you thyroid supplement or not. Are you gaining weight?
Yeah, somehow I feel like I'm just simply getting weight.
And you're feeling a little tired and
Yeah, always exhausted somehow.
and do you you like hot weather or the cold weather? Is there something like that?
I prefer hot.
You prefer hot, so your thyroid is less than you are high. And you have any constipation issue?
Constipation is not really.
No?
Not really.
No. So you have some hypothyroidism, so we'll see your thyroid and accordingly we'll give you good medication so that you become
But most of the time mine is like hypo.
hypo. No? Yeah, that's what hypothyroidism. Because half thyroid is removed. Other thyroid also has nodules now. So for hypothyroidism you are not taking anything?
Right now I don't have a medication.
No,
because
I'll
I
give you.
just
I'll give you
landed from abroad. So
from abroad.
yeah.
Why? We'll give you these are normal medications you get right here, right everywhere in fact. So take that so that you don't gain weight, you don't become, your skin doesn't become rough, you don't become lethargic. Okay?
Especially my heels, they are always cracking.
Cracking.
Yeah.
And you have thick skin there, you have edema here? Here. You have any edema on this side? No.
Oh,
Let me see.
but this is always, I always have a cold feet.
So let us see how your thyroid is. The tests were done yesterday. I'll check that to prescribe you medication, okay?
Okay. What kind of food should I eat now?
No, food there is no restriction.
Okay.
You
so
can
I
eat
have
anything.
Because mostly I love spicy. So
Alright, have spicy. We'll tell the cook to make spicy food for you. Don't worry. You eat anything. Regarding thyroid, but you have blood pressure or anything? Do you have it?
no.
Oh, that was the other patient. Okay. Any diabetic in your family? So how difficult was it worthwhile coming from Manipur to my place? Of course you can do it. Just stay for one day. Stay here. There won't be anything. 99.9%. But 0.1% or 1% we don't know, na, body. Normally people come from far and wide. They get it done. And within 4-6 hours they go
So
home.
I'll just rest tomorrow in Chandigarh.
Huh.
And the next day I'll flew down to my place. Yeah.
Yes. Of course. Yes. Passes or no? Will I get some free cruise passes? Oh, she's laughing. She's not ready to. Well, you should say you haven't done my surgery free. Why should I give you free passes? I've been to Paris couple. You want to change side?